There comes a time in every person's life when the body sends signals so urgent that ignoring them can cost precious time, health, or even life itself. These signals are not just random aches or fleeting discomforts. They are messages from within, cries for immediate attention, whispers that turn into shouts if left unheard. As a doctor who has seen the fragility of human life unfold in countless moments, I want to speak directly to you, especially if you are in the later years of your journey when every moment counts more than ever. There are 7 urgent warning signs your body can give you that demand no delay, no second guessing. These are the moments when the wise choice is to seek the hospital without hesitation. Only you can know when these signs are true for you, and recognizing them may be the difference between a recovery and a tragedy. Let us start with severe chest pain. Many people brush off chest discomfort as indigestion, stress, or muscle strain, but chest pain that feels like a heavy weight crushing your chest, that may radiate down your arm, into your jaw or back, should never be ignored. This is the classic warning of a heart attack. The American Heart Association has long emphasized the importance of immediate action, as heart attacks kill more people worldwide than any other disease. Studies have shown that patients who reach the hospital within the first hour of chest pain have dramatically better survival rates. When blood flow to the heart muscle is blocked, every second counts. Delay can mean irreversible damage to your heart or death. If you experience this pain, especially if accompanied by shortness of breath, sweating, nausea, or lightheadedness, call for emergency help immediately. This is not the time to be cautious about bothering the hospital. Your life depends on your response. Next is sudden weakness or numbness on one side of your body. Imagine waking up or suddenly feeling that your arm or leg is limp, your face drooping, or that your speech is slurred. These signs indicate a possible stroke. A stroke is a blockage or bleeding in the brain that robs part of your brain cells of oxygen. The National Institute of Neurological Disorders and Stroke has proven that the first 3 hours are critical for stroke treatment. Thrombolytic therapy or clot-busting drugs can reverse the damage, but only if given quickly. If you notice these symptoms, even for a few minutes, call emergency services immediately. The window to act is small, and every delay increases the chance of permanent disability or death. Never think these symptoms will pass on their own. They may, but the cost can be your ability to move, speak, or even think clearly ever again. Sudden and severe difficulty breathing is another warning sign that should never be ignored. You may feel like you cannot catch your breath or that your chest is tight and constricted. This could be a sign of a serious lung problem, such as a pulmonary embolism, pneumonia, or even a severe asthma attack. Pulmonary embolism is a dangerous blood clot that travels to the lungs and can be fatal within minutes if untreated. The Centers for Disease Control and Prevention have reported that sudden breathlessness, accompanied by chest pain, coughing up blood, or rapid heart rate requires immediate medical intervention. The hospital is the only place where they can quickly diagnose and treat these life-threatening conditions. If your breathing feels labored and you cannot speak more than a few words without gasping for air, do not wait. Call for help. A sudden and severe headache, unlike any you have ever experienced, also demands immediate attention. Some people might dismiss headaches as part of aging or stress, but a thunderclap headache that hits suddenly and intensely can be a sign of a brain aneurysm or bleeding inside the brain. Research in neurology journals emphasizes that this symptom requires urgent imaging studies to prevent catastrophic brain damage or death. If your headache is so severe that it wakes you up, or is accompanied by nausea, vomiting, vision problems, or loss of consciousness, get to the hospital right away. The sooner the doctors can act, the better your chances of survival and recovery. Next, confusion or sudden changes in mental state, such as extreme drowsiness, difficulty waking up, or unusual behavior, especially in older adults, must be taken seriously. These signs can indicate a variety of urgent medical problems, including infections like sepsis, severe dehydration, or brain injury. A study published in the Journal of the American Geriatric Society highlighted that altered mental status is a strong predictor of serious illness in seniors. Since the brain is sensitive to changes in oxygen, toxins, and infections, this symptom signals that your body is struggling to maintain balance. If you or someone you care for becomes suddenly confused or unresponsive, get medical help immediately. Do not wait for it to improve or assume it is just old age. Sudden loss of vision or double vision is another critical sign that should never be delayed in treatment. Your eyesight is precious, and sudden changes could signal a stroke in the eye, retinal detachment, or other severe neurological issues. Studies indicate that the retina is highly sensitive to blood supply, and without immediate treatment, vision loss can be permanent. If you notice that you are suddenly unable to see out of one or both eyes, or you experience double vision, head to the hospital immediately. Waiting can mean irreversible blindness or serious brain injury. Finally, severe abdominal pain accompanied by vomiting, fever, or swelling signals a medical emergency that cannot wait. This pain may come from a burst appendix, a severe infection, or a blockage in your intestines. Research in emergency medicine shows that abdominal emergencies require prompt diagnosis and often surgery to prevent complications like sepsis, which is life-threatening. The elderly are especially vulnerable because their symptoms may be less obvious but equally dangerous. If your stomach pain is intense, persistent, and worsening, do not hesitate to seek hospital care immediately. Each of these 7 warning signs demands respect and immediate action because they reflect underlying processes that can deteriorate rapidly. Seniors are particularly at risk because the body's ability to compensate for illness often diminishes with age. Scientific studies across cardiology, neurology, pulmonology, and emergency medicine have consistently proven that early hospital treatment saves lives and reduces long-term disabilities. Do not doubt your instincts if you feel something is seriously wrong. You are the best judge of your body's messages. When these signs appear, trust yourself enough to seek help without delay. Remember, going to the hospital at the first hint of these symptoms is not a sign of weakness or unnecessary worry. It is a courageous act of self-respect and wisdom. The doctors and nurses there are trained to handle emergencies. They rely on you to be honest and prompt in sharing what you feel. Waiting or dismissing these symptoms as minor can cost you the chance for a full recovery. Your life, your health, and your family's peace depend on how quickly you respond. So if you feel crushing chest pain, sudden weakness or numbness on one side, severe breathlessness, a sudden terrible headache, confusion or sudden mental changes, sudden vision loss, or severe abdominal pain, do not hesitate. Call emergency services or get to the hospital immediately. Only you know your body best, and only you can act to protect it. Your life is precious, and these signs are urgent warnings that demand your immediate attention. Listen to them carefully, act swiftly, and give yourself the best chance to live well and strong. What are some resources or tools that can help seniors stay safer and healthier? There is a profound truth in the idea that growing older does not mean giving up control over your health or safety. It means learning new ways to protect yourself, to stay connected, and to live with dignity and strength. In my years as a doctor, I have seen the difference that the right resources and tools can make in the lives of seniors. These are not just gadgets or services. They are lifelines that provide safety, support, and peace of mind. When embraced thoughtfully, they become an extension of your own wisdom and care, helping you maintain your independence and quality of life. It is important to understand that these tools are grounded in research and real-world results, proven to make a difference when used correctly. One of the most valuable resources for seniors today is medical alert systems. These are devices designed to be worn on the wrist or neck, equipped with a button that can summon help immediately if you fall or face a medical emergency. According to a study published in the Journal of Medical Internet Research, seniors who use medical alert devices were more likely to receive timely assistance during emergencies, such as falls or sudden illnesses. The data showed that prompt medical response reduced hospital stays and improved recovery outcomes. These systems often come with features like fall detection, GPS tracking, and two-way communication, allowing you to reach emergency responders or loved ones with a single press. This kind of support is critical, especially for those living alone or in remote areas. Technology has expanded far beyond just emergency alerts. Telehealth services have revolutionized how seniors receive medical care. Instead of traveling to a clinic or hospital, you can now consult with your doctor from the safety and comfort of your home. The National Institute on Aging reports that telehealth reduces barriers to care by improving access, especially for those with mobility issues or chronic illnesses. Studies confirm that virtual visits can be as effective as in-person appointments for managing many conditions, from diabetes to hypertension. Telehealth allows for continuous monitoring and early intervention, which prevents complications that often lead to hospital admissions. It also provides a valuable connection when traveling or during times when in-person visits are limited, such as during flu seasons or pandemics. Medication management is another critical area where resources can help seniors stay healthier. Taking multiple medications daily can be confusing and risky. Research from the American Geriatric Society highlights that medication errors and non-adherence are leading causes of preventable hospitalizations among older adults. Tools like pill organizers with alarms, smartphone reminders, or automated dispensers ensure that the right medicine is taken at the right time. Some dispensers even notify caregivers or pharmacists if a dose is missed. These systems have been shown to reduce medication mistakes significantly and improve health outcomes. They offer seniors peace of mind and freedom from the anxiety of managing complex medication schedules alone. Physical activity is vital for maintaining strength and mobility, but it can be difficult to stay motivated or safe without guidance. Fortunately, there are simple tools designed to encourage movement while reducing the risk of injury. Balance aids such as walking sticks, grab bars, and non-slip mats create safer environments at home. Studies in gerontology have shown that homes equipped with these aids experience fewer falls, which are a leading cause of injury and loss of independence in seniors. Additionally, wearable fitness trackers can monitor activity levels, heart rate, and sleep patterns, helping seniors and their healthcare providers adjust exercise routines to fit individual needs. Research published in the Journal of Aging and Physical Activity demonstrates that seniors using wearable devices are more consistent in their physical activity, improving overall health and reducing the risk of chronic diseases. Nutrition plays a fundamental role in health, yet it is often overlooked. Many seniors face challenges in maintaining a balanced diet due to physical limitations, lack of appetite, or difficulty accessing fresh food. Here, community programs and technology combine to offer solutions. Meals on Wheels and similar services deliver nutritious meals right to the door, ensuring consistent, healthy nutrition. Evidence from public health studies indicates that regular access to healthy meals improves energy levels, immune function, and mental health among seniors. For those comfortable with technology, grocery delivery apps provide an easy way to obtain fresh ingredients without the strain of shopping in person. Some apps even offer tailored meal planning and recipes that accommodate dietary restrictions, such as low-sodium or diabetic-friendly diets. Using these resources helps seniors maintain a diet that supports strength, healing, and vitality. Staying socially connected is just as important for health as physical care. Loneliness and isolation are significant risk factors for depression, cognitive decline, and even early death. According to research from the National Academies of Sciences, Engineering, and Medicine, social isolation increases the risk of mortality by nearly 26%. Fortunately, many tools and programs are designed to keep seniors engaged. Video calling platforms allow face-to-face interaction with family and friends, bridging distances that once felt impossible. Community centers, senior clubs, and volunteer organizations offer opportunities to participate in group activities safely. Some seniors find comfort in companion apps or telephone check-in services, which provide regular social contact and wellness monitoring. These social resources are not luxuries. They are essential to maintaining emotional health and a sense of belonging. Transportation can often become a barrier to health and independence. Losing the ability to drive should not mean losing access to medical appointments, grocery shopping, or social events. Ride-sharing services and specialized transportation for seniors have emerged as practical solutions. Studies on transportation programs for older adults show improved health outcomes and greater participation in community life. Some local governments provide subsidized transport options designed specifically for seniors, which include assistance with boarding and getting to appointments. These services reduce the risk of missed care and help maintain a routine that supports physical and mental well-being. Using these tools ensures that a lack of transportation does not lead to isolation or neglected health needs. Lastly, educating oneself about health conditions and preventive care empowers seniors to take charge of their well-being. Trusted websites, support groups, and community health workshops offer accessible information tailored to senior needs. Research from health education fields confirms that informed patients are more likely to adhere to treatments, recognize warning signs early, and engage in healthy behaviors. Many hospitals and clinics offer free or low-cost programs that teach skills such as managing chronic diseases, fall prevention, or nutrition. Taking advantage of these educational resources provides seniors with knowledge that strengthens their ability to live safely and with confidence. In summary, the path to staying safe and healthy in later life is supported by a growing array of resources and tools, all rooted in evidence and designed to meet real needs. Medical alert systems, telehealth, medication management, physical safety aids, nutritional programs, social connection platforms, transportation options, and educational resources form a network of support that can empower you every day. As you consider these tools, remember that embracing them is not a sign of weakness, but a powerful choice to protect yourself and live fully. Your body speaks to you in many ways, and using the right resources is a way of listening carefully and responding wisely. These tools become allies in your journey, helping you maintain your independence, your dignity, and your health with strength and peace.